So I also want to talk about hospitalization. Hospitalization is not the be-all and end-all when people are suicidal. I certainly also don't want to go to the opposite extreme and say never hospitalize someone or that it's not important. Hospitalization does have a time and a place and can be beneficial and helpful. But it's important to know that it's not necessarily the first step, which is why I didn't put that as the first item under treatment of people who are suicidal. It's important to think about the pros and the cons of hospitalization. As I said, it's not always a solution. It's 2019. Hospitalization is short term. Sometimes people who are hospitalized for suicidal intent may only remain there for 3 days, and then they're returned to your care. So it's not necessarily the answer to all of the issues with regard to treatment. There's also a very high rate of suicide in hospitals. Not only is there a high rate of suicide in hospitals, there's also a high rate of suicides on a weekend visit from a hospital, depending on the arrangements of that hospital, and also immediately upon discharge from hospitals. And sometimes people feel, if this is what happens when I tell someone I'm suicidal, there's no hope. And again, that leads into the idea of hopelessness, but sometimes hospitalization can increase the risk and the potential for suicide. And I must say that I had the unfortunate experience of working in a psychiatric hospital with a psychiatrist who was suicidal, who was hospitalized, and who in fact did commit suicide as part of that hospitalization. So these things are real and they do happen.